Hello, everyone, and welcome to my School of Evidence-Based Aromatherapy. I just wanted to share a little bit with you before you choose the classes or before you start classes, a little bit about me, and I will be teaching your classes. My name is Pam Conrad. I am a registered nurse. I have been for over 30 years, and I have been a certified clinical aromatherapist since 2000. I specialize predominantly in women's health clinical aromatherapy. I also bring other clinical conditions in and have backgrounds also in psychiatric nursing as well as cardiovascular nursing. So we'll have classes on those as well. So I just wanted to tell you a little bit about my background so you know who's teaching you. I've been teaching since 2000 and my nursing background, I did traditional allopathic nursing for many years, and I was a trauma nurse in a level 1 trauma center, an emergency room, and an operating room, and in the ICUs. Always since the beginning of my nursing career, I graduated from Purdue University. And from the beginning of my nursing career, I was always fascinated about holistic medicine, about preventative medicine. How can people learn to take care of themselves so they have the best outcomes? I also believe in integrated medicine. So I believe the best that traditional allopathic medicine has alongside the best that we have in CAM, the complementary alternative medicine field. In 2000, I became a certified clinical aromatherapist. It was an 18-month program. And then in 2001 to 2004, my family was transferred to England. So I completed graduate school there in complementary therapy studies, and I also did a 1.5 year long clinical internship with Denise Tehran in Queen Mary's Women's Hospital, where I worked with her predominantly in the prenatal clinic and also women laboring and women postpartum. And that's where I learned really to bring these all together. I also went to Oxford John Radcliffe Hospital and met with the midwives who had done the 8-year study of over 15,000 women receiving aromatherapy in labor. And that really is the foundation of my classes that I've taught for the last almost 20 years. I also went on to Chesterfield Hospital just to see how they could replicate that program so I'd know how to bring that back. Studied advanced clinical aromatherapy in Provence, France. Also, I did a little bit of side clinical aromatherapy with the nurses and practitioners at the Bristol Cancer Center. So I have worked also many years with cancer patients in addition to the maternity obstetric aromatherapy. Completed a master's diploma at University of Westminster in complementary studies at their Graduate School of Integrated Health. In 2007, when I returned to the US, between 2004 and 2007, I taught adjunct faculty at Indiana University, Purdue University, saw patients privately. And in 2007, I created curriculum with the American Holistic Nurses Association and developed the first in the United States evidence-based OB aromatherapy program, taught a group of 15 nurses, and we started the first in the US hospital-based aromatherapy program, which still is in existence today. Since that time, I have taught nurses in over 20 states, also in South America and in Canada, and now Japan and Australia, etc. In 2012, we published. In 2010, in 2011, we did the research. We did clinical aromatherapy research on high-risk postpartum women with depression and anxiety. And it was a year-long study, and that was published in a peer-reviewed journal in 2012. 2015, and again in 2017, I was invited by the midwives in Santiago, Chile in South America to come and teach their midwives evidence-based clinical aromatherapy. So I went there twice. I did a level 1 2 times, and I did an advanced level the second time I was there. And at this time, many of their midwives have very progressive aromatherapy practices, businesses, schools since I was there. 2019, I was asked by a UK publisher to write an evidence-based guidebook for nurses and midwives and doulas and therapists, looking at the current evidence base that exists for obstetrics, so prenatal, and then interpartum, so that's the labor and childbirth, and the postpartum. Also, the second half of the book is on premenstrual syndrome, menstrual irregularities, and menopause. That was published in 2019. In 2020, all of my live classes, I had been teaching staffs of nurses in multiple hospitals throughout Indiana, my state, and other states as well. And in 2020, with the pandemic, I was forced to take my courses to live online courses. So I've taught those for that same curriculum, but I've taught it live online for the last year and a half. And now I'm starting a school that'll be an online school that will have recordings of many of the classes that I've taught over the years that'll be available to you all over the world whenever it's convenient for you. In 2021, so just a few months ago, actually, my guidebook was published in Spanish. So both are available on Amazon, or the English one is also available on Book Depository, or wherever your books are sold. The Spanish one is only available on Amazon, and it is called Aromatherapy Femenina, so you can find it there. So I welcome you to my classes, and also I want to invite you, if you'd like, I have a very large Facebook group called Aroma Tips for Nurses, Midwives, Doulas, and Therapists. You may ask to join. My Instagram is Aromas for Healing. So look through the courses, see what you'd like to take, and enjoy. Thank you.